Heart surgery is a lifesaver for thousands of people across this country. Now there's new evidence about what technique works best for cardiac bypass surgery. About 10 to 15,000 Canadians have bypass surgery every year. We all know someone who has had it or is about to have it. And Dr. Zetner is here to explain this new research. So there's off-pump and on-pump. Can you explain the difference?
So when we think of pump, I want us to think of a heart-lung machine. So on-pump bypass surgery is where we stop the heart. We put the patient on a heart-lung machine, and that's where the machine literally pumps blood to the brain and other organs while the surgeon does the bypass on the heart. Off-pump bypass surgery is where there is no heart-lung machine, where we literally open the chest and perform the bypass surgeries on a beating heart that is still pumping to the brain and other organs.
And up until now, which has been considered the gold standard?
So we had normally performed bypass surgery routinely in North America in particular on pump, where we used a heart-lung machine. Interestingly, in the rest of the world, off-pump bypass surgery is very common. In fact, 90% of all surgeries in Asia and India are performed off-pump.
And a cardiac thoracic surgeon in Boston looked at all the research, the existing research. What did he find?
So this was a large-scale review published in Circulation looking at a variety of trials comparing off-pump and on-pump. The idea was that if you performed the surgery without the heart-lung machine, the thought was that you decrease the risk of stroke, heart attack, death, other morbidities associated with using this bypass machine.
Because the heart is still beating.
Exactly. But in reality, all of the trials up to date have shown no difference between both short and long-term complications in patients on a bypass machine during surgery versus off a bypass machine during surgery.
So someone who's facing this surgery in the months, weeks and months ahead, what should they take away from this?
I think it's important to talk with your surgeon about their skill level. Obviously, the surgeon's going to make the decision, but if you have a surgeon who's highly skilled in off-pump surgery, then that's the way to go. If you have a surgeon who's highly skilled in on-pump surgery, then that's the way to go. And it is patient-dependent as well as surgeon-dependent.
All right, Dr. Zetner, thank you.
Thank you.